Hello, and welcome to Anatomy with John and Scully. Today we're going to be talking about the rhomboid minor. We'll be going over origin, action, innervation, insertion, and blood supply. Thanks for joining. Alright, so taking a look at rhomboid minor. Bring Scully a bit closer here. We're looking at Scully's left scapula. Over here. So the origin of rhomboid minor, as you'll see above, we're looking at the ligamentum nuchae and the spinous processes, or the spines of C7 and T1. Ligamentum nuchae, as we've talked about in previous videos, is going to be coming from the external occipital protuberance, attaching to the posterior tubercle of C1, attaching to C2, 3, 4, 5, 6, and 7 spinous processes. So that's the ligamentum nuchae. And again, the spines of C7 and T1 are also going to be origin points of rhomboid minor. Looking at the insertion, it's going to attach to the medial aspect of the scapula around here at about the height of the spine. So that's the insertion of rhomboid minor. And so again, 1, 2, 3, 4, 5, 6, 7, 7 T1, and then we're coming over across to about the spine of the scapula there. Okay, so that is the origin and insertion of rhomboid minor. Moving on to action. Just turn you here for a second there, Scully. All right, so the rhomboid minor is going to help to fix the scapula on the thoracic wall, or stabilize might be a better term. It's also going to help to retract the scapula. Based on its origin and insertion point, it also is going to help to downwardly rotate the scapula. And so what that's going to do is going to depress the glenoid cavity. So those are the actions of rhomboid minor. Moving along to innervation. It's going to receive innervation from the C4 and C5 nerve roots off the brachial plexus. Nerve roots are named in the cervical spine. In terms of the vertebrae, the nerve is named above until we get to C8. So 1, 2, 3, 4, there's C4, which means the nerve root above is going to be the nerve roots there. And then 1, 2, 3, 4, 5, the nerve root above will be the nerve root for the dorsal scapular nerve, which supplies innervation to rhomboid minor. So it is the dorsal scapular nerve, and those roots are coming off of C4 and C5 from the brachial plexus. Lastly, looking at blood supply. Blood supply is going to be coming from the dorsal scapular artery or the deep branch of the transverse cervical artery. So we're going to go over that here. So depending on where the artery exits is where it gets its name. Okay, so it's being named from its origin. So let's start with the subclavian artery. So subclavian artery is here. If we have an exit up the thyrocervical trunk, and then it goes into the transverse cervical artery, that's where we would get the deep branch of the transverse cervical artery. Okay, so once again, coming off the subclavian, which is going to be below the clavicle, but above the first rib, it's going to have an exit of, some people will have, there's variations, there's these two, which is why there's two options. It goes up to the thyrocervical trunk, to the transverse cervical artery, and then we can have a deep branch that supplies the rhomboid minor. So the second option, so the OR, as above, is the dorsal scapular artery. And so instead of receiving blood supply from the deep branch of the transverse cervical artery, the dorsal cervical artery is going to come right off of the subclavian artery. So it's just going to be an exit off the subclavian artery right to the rhomboids in there. So essentially the artery that supplies rhomboid minor is going to be named based off of its anatomical origin, which is variable. So it's either the deep branch of the transverse cervical artery, or it's directly off of the subclavian artery, which would be called the dorsal scapular artery. It also is going to receive blood supply from the upper 5 or 6 posterior intercostal arteries. And so upper 5 or 6 and through here, it's going to come through and supply blood supply to the rhomboid minor. And so there you have it. Origin, insertion, action, innervation, and blood supply of the rhomboid minor. Thanks for watching. And don't forget to eat your leafy greens. Take care, guys.